Hello, I'm Dr. Stephen Hassan with another episode of the Influence Continuum. And I have a very special guest who's a world authority on the subject of dissociation. He is the former president of the International Society for the Study of Trauma and Dissociation. Eli Somer is a PhD, professor emeritus of psychology at the University of Haifa School of Social Work. He's also a licensed clinical psychologist. You're also a hypnotist. You're also a certified supervisor of psychopathology and psychodiagnostics for clinical psychology interns. You've been treating survivors of trauma since the 1980s. What else should I say? Yourself, you are a son of Holocaust survivors as well as a war veteran.
Right.
And you've written over 140 scientific publications in the field. I am so impressed by. I think I've got 8 or 9 under my belt, but I only got my PhD a few years ago. But still, I'm super impressed by your amazing thing. But Ellie, you've identified a phenomenon called maladaptive daydreaming. And I've been reading your articles on academia and ResearchGate, and I've been wanting to interview you. And because, as you know, I talk about cults and brainwashing and mind control. I know Melanie Steinberg, and I've been exposed to the SCID-D, the structured clinical interview for diagnosis for dissociation.
Right.
I just think we have a lot of trauma happening in the world, but I think we have a lot of dissociation happening in the world, and the internet's not helping. It's making it worse. So with that, I'd love for you to teach, and my audience, I'm sure, is filled with clinicians as well as former cult members and media people as well.
So what would you like me to talk about?
Well, let's start with, as the former president of this prestigious international, organization studying trauma and dissociation, maybe start with what is dissociation and how does it relate to trauma? And then we can go from there.
Well, maybe it's the opposite of association in reference to various mental functioning. So we're talking about the disintegration or the less than optimal coordinated functioning of various mental capacities, such as memory and feelings and sense of identity even. So the idea is that under duress, under severe stress and trauma, it is sometimes beneficial for victims, for people who undergo such conditions, not to feel as much, not to remember as much, even to the extent that they perhaps would not remember that they were there or that it happened to them. So these disintegrating functions are mostly associated with trauma. And what starts as a possible or potential defense mechanism can go awry when the trauma is over, and this still remains as the primary way of being in the world, the primary way of coping with stress in the world. Because when a person cannot fully be present, fully feel his or her body, have a sense of agency. When the sense of agency is disintegrated from the body, that can create a lot of confusion and problems and suffering. And that's where clinicians come into play, trying to help these survivors.
Right. So just from what you've said, I have 20 questions, but I want to just stay on track, and I want to make sure to go into maladaptive daydreaming. But if I may ask a few more questions. So what I heard you say is, Steve, in my professional expertise and my experience, people don't need to remember everything that happened to them if they were traumatized. And that flies in the face of a lot of what I'm seeing in America, at least, which is a focus on trauma processing and trying
Mm-hmm.
to push the person to go back to remember things to the point where people are getting suggestions that they were sexually abused by parents in their
Mm-hmm.
earliest childhood when it never happened, and conflating it. Often the people accusing actually were sexually assaulted by a boyfriend or by some criminal type, but they're being encouraged to remember, well, if that happened, there must have been something earlier in your life
Mm-hmm.
that set you up for it. So what's love to hear from you.
Well, I think it is bad therapy to suggest that something happened when the therapist has no way of knowing what actually are the historical facts in the patient's history.
Right.
So that is always, bad practice, and I think is widely agreed on among professional circles in my clinical community.
Mm-hmm.
It is true that certain clusters of symptoms are very typical of the outcome of abuse. For
Mm-hmm.
example, if a person displays post-traumatic symptoms, flashbacks,
Yeah.
nightmares with specific topics and
Yeah.
events unfolding, uh, extensive avoidance behavior when exposed to triggers suggestive of specific trauma, then it is first of all perhaps justified to explore these symptoms, because I totally stand behind the idea that some demons are perhaps better left dormant
Mm-hmm.
uh, if there are no symptoms. So
Right.
if a person knows that they have had a terrible childhood, but they have no memories and no symptoms, there's no reason to dig.
Yeah.
Um, but if there's dysfunction, if there's pain, if there's suffering, if suicidality, and so on, then it is important to help these people. But these procedures, I'm sure we could agree on, are risky, maybe like open heart surgery is.
Mm.
Sometimes you need to cut open the chest and exchange arteries, and because leaving the patient as is could really significantly shorten their lifespan. However,
Right.
the patient may die on the operating table.
Right.
So there are risks involved.
Yeah, risks involved. So, I mean, and I'm sure we agree, Occam's razor, if we know somebody was drugged and raped, it's a fact. We treat the symptoms for that. And then if only
Right.
if there are residuals, but after thorough clinical therapeutic stuff, then we may want to explore other things,
Right.
correct?
Right.
So you're also an expert in hypnosis, and back in the '80s, there was a whole satanic panic thing where, and Michael Yapko even wrote a book called Suggestions of Abuse, where people were rushing to these 2-day workshops and being told they should do regressive hypnosis to uncover the sexual abuse or satanic cult stuff, and it was exposed to be just bad therapy,
Mm-hmm.
with no evidence that the whole city raped them.
Right.
They were
Right.
all in a satanic cult, and
Right.
where
Mm-hmm.
people were being accused who weren't even alive when the assault presumably happened.
Mm-hmm. So that's a comment, not a question,
Yeah,
right? Yeah.
it's a no. Did you come across that in your professional experience where people were doing hypnosis incorrectly and looking for things? This is a problem in the
this practice
States.
has been shunned upon for decades now. So people don't. I mean, that's the way I teach it, and that's how
Right.
my colleagues practice. We don't induce people into an hypnotic trance in order to look for trauma.
Right.
What we might do sometimes is the opposite. Use hypnotic strategies to help the patients self-regulate or self-hypnotize, so they don't suffer as much.
Exactly.
Yeah, we do that, and let me tell you that. I once tried to induce a false memory. And here's the story. I had a patient who had memories of something cylindrical in a cylinder shape inserted in her mouth, and she had gagging reflexes and fleeting episodes of memories, very short memories that it might be associated with her father, but she did not want to believe it.
Mm-hmm.
She very much wanted to believe that, in fact, she was choking on a carrot.
Yeah.
And she asked me to use hypnosis to make her believe in this memory, in this alternative memory. You might want to call it false memory.
Interesting.
I wasn't sure if this is the appropriate practice, but I decided to go for it because the patient asked for it, and I was not inducing something that could perhaps disrupt family relations, and
Right.
the patient thought it would help her.
Right.
So I did my best, and she was highly hypnotizable. She was a dissociative patient. She went into trance, and I made the suggestions that she herself wanted to believe in.
Right.
But it wasn't successful. It actually burst her amnesia bubble, and a flood of awful traumatic memories erupted in response to my attempt to implant a false memory that was positive.
That's
But
fascinating.
it didn't work.
Right. But it's fascinating. She wanted you to do this in a way. Maybe her unconscious was trying to get
Right.
you to do something that would allow her to heal by opening up memories. I
Right.
don't know.
Yeah.
So can I ask you, while we're talking about this, about parts? Parts therapy, and Richard Schwartz has this whole system that has come under great scrutiny called internal family systems, where there's like an emphasis to parts as opposed to integration and
Right.
functionality. Like,
Right. Right.
any comments? We will get to maladaptive daydreaming
All right.
shortly.
All right.
I promise.
Look, it's this conceptualization relates to a way of trying to understand how we as people, as children, adapt. So in a normal adaptation process, we develop specific specialized ways of being to adapt best to different circumstances. So if a child is to adopt optimally, it would not whine and cry as much in kindergarten, but would be more playful and perhaps show different aspects of itself. But when at home and feeling sad or hungry or scared, it would allow itself to be more needy.
Mm-hmm.
So these are different ways of being and adapting. I'm trying to think about myself. I can be a leader, I can be a professor or a scholar, The way I talk to you now, I will not talk to my wife. But sometimes, I, I, I feel like I want to rest my head on her lap and have her caress my hair. I would not do it to a patient of mine because it's a different part of me. It's not a different personality.
Right.
Yeah. So we have different ways of being, and
Yeah.
sometimes it's helpful to acknowledge it, but to suggest that these are different personalities is a mistake. Even in dissociative identity disorder, we're not talking about different personalities. We're talking about different aspects
Right.
of the same person.
Right. Different
So
parts.
I think, like every phenomena in psychology, it lies on a continuum.
Right.
And I think people who don't vary at all and are the same all the time have a personality disorder.
Yes. Good point.
Yeah.
Very good point. The way I think about it, if I may opine, is just that our brain evolves in networks of neuronal associations. And so if I think back to me at 8 years old, I'm activating those networks.
Right.
Not that it would be 100% accurate. And no one knows how to tell. But the idea is when Steve, the basketball player, goes on the basketball court, he's not the PhD and the cult
Exactly.
expert. I wouldn't be able to function. you know.
Exactly.
So, but it's not a different me. It's just how I'm activating my resources
Exactly.
in an organized way. And I feel like the most functional people have that integration where they can switch, Oh,
Exactly.
I have to do an interview. I'm going to put on my hat even though I feel like crap. And I'm going to be up and,
Yeah.
articulate, or I have to give a
Yeah.
lecture.
So you may call it, so that's the doctor me, or
Exactly.
the child me. Yeah.
Exactly. So before we go to maladaptive, because you're an expert in hypnosis, I'm seeing this phenomenon online where hypnotists, like I'm going to name one from the UK, McKenna, is now developing coaching programs and telling anyone they can learn to be a coach and do hypnotherapy. And I'm aghast. I'm like, oh my God, what a mess. Because people aren't trained in the subtleties. And, we've spent years learning about how to act,
Yeah.
ethically.
Well, it worries me. It worries me because hypnosis can be a powerful tool, and some people are highly hypnotizable, and and there's a correlation between having a dissociative disorder with a trauma history and hypnotizability. So you better be very careful about it. And in Israel, for example, where I'm located, only licensed professionals can get a hypnosis license, and you have to be a Ministry of Health certified hypnotist.
Yeah.
So it's regulated.
I'm glad you mentioned it. I was going to mention if it's still a law because it's the only country that I'm aware of in the world
Yeah.
that has protections for its citizens
Mhm.
because of the recognition of the power of hypnosis, of the
Right.
power to harm.
Right.
So that's a really positive thing. So now let's move into maladaptive daydreaming. It's so fascinating. What does that mean? What
Well,
do you think?
what do I think? Well, we all daydream, of course. And several times a day, but we sometimes confuse associated terms. So there is mind wandering. That's not exactly daydreaming, although in the literature it's used interchangeably, and it's not right. So in mind wandering, when somebody is not attentive, actually the brain is on idle mode, not
Mm-hmm.
focusing on anything, and spontaneous thinking is occurring mostly over mundane, day-to-day things like what to cook for dinner, or rehearsing a conversation one had with a supervisor, or planning an appealing conversation with somebody one is interested in. That's not really fantasizing. That's and the mind sort of wanders from one thought to the other. That's when the mind is resting, is off task, we call it.
Mm-hmm.
Uh, some people have the ability to fantasize very vividly, but that's something else. That's in those cases, the mind is on task, not off task.
Mm.
Scripting, planning, directing, or even acting internally in the mind different scenarios that are fantastical, that are not associated with reality.
Mm-hmm.
And if it is associated with reality, it's about idealized versions mostly of reality.
Mm-hmm.
And people who do that apparently have a trait, an ability to immerse themselves in the fantasy. And this is where it's associated with dissociation, because in dissociation, one of the clusters of dissociative experiences is the ability to be fully immersed in a stimulus or in an activity to the exclusion of all other
Mm-hmm.
stimuli in the environment. So this is about the ability to immerse yourself fully and to experience very vividly with a sense of presence, a fantasized, very highly imaginative scenario in your mind that can create emotions
Mm-hmm.
and feelings. And, we call this immersive daydreaming, this which in itself is not pathological.
Mm-hmm.
So when does any behavior or psychological phenomena become a disorder? Let's borrow these ideas from the DSM. It's when the set of behaviors either create psychological distress
Right.
or impair functioning.
Right.
So when that happens with immersive daydreaming, we call it maladaptive daydreaming. It's a very cumbersome term because when I first identified this phenomenon, I was hesitant of calling it a disorder because it was not described anywhere in the literature.
Right.
So more humbly, I called it maladaptive daydreaming. It's an awkward title. Maybe it will change in the future when it gets to eventually to the DSM and will be called I don't know, something like dissociative daydreaming disorder or something like this.
Mm-hmm. Mm-hmm. So I couldn't help when you were describing that full immersion. We were just watching the Olympics, and we were seeing the athletes before they were performing doing a self-hypnotic phenomenon
Right,
and they were describing seeing them do their perfect routine over
right,
and over and over again.
right.
So that was adaptive
Yes,
focusing of attention.
yes,
So can you give us an example of a one that's impairing function or something that is
yes.
impeding?
Well, first of all, let me say that people who do it, I don't have this ability, this capacity to fantasize in such an absorptive way. But people who do it, first of all, they report that it is highly rewarding.
Mm.
I mean, imagine having a virtual reality apparatus between your ears. Is
Well, you become J.K. Rowling and make billion
exactly,
dollars.
exactly, exactly. So, so, uh, so if it is so rewarding, some people tend to do it more
Mm-hmm.
frequently, and spend more time in this mental state. And that can be at the expense of meeting other obligations,
Mm.
such as doing homework or completing your academic tasks,
Mm-hmm.
or socializing with family and friends.
Mm-hmm.
So sometimes it is even at the expense of eating or sleeping. It is that much fun, they say.
Mm.
So when people and there's another aspect to it. Some people sometimes try to fantasize idealized outcomes uh, for their life. For example, people who are aspiring to be performing artists or scientists imagine in their fantasy achieving their goals in life, but in reality, they do very little to advance themselves.
Uh-huh.
So
So
when they come to,
disconnect.
yeah,
But
so when they come to, they feel very bad of
mm-hmm.
wasting their life in fantasy.
uh,
So it's a cycle of people feeling distress, regulating their distress with fantasy, uh, wasting time, being disappointed at that, and then um, uh, comforting themselves with more fantasizing.
mm-hmm. Mm-hmm.
So, going back to the beginning of our conversation, who are more prone to this? People who have survived the hardships in life or childhood trauma, for example, and have this ability. Of course, they can soothe themselves and
Mm-hmm.
regulate their pain by imagining alternative families, alternative life circumstances,
Right.
just to feel good,
Yeah.
which is nice. I mean, everything is a continuum in psychological phenomena. So, in moderation, can be very helpful, lead to creativity, serve as a defense mechanism, but applied excessively, it can cause problems.
Right. So, is there any evaluation or measure that you've come up with that somebody could, diagnose this or self-diagnose?
Sure, sure. Um, if you Google maladaptive daydreaming research, probably on the first page, if not the first hit, would be our research website, the
Okay.
International Consortium for Maladaptive Daydreaming Research. And on the measures tab,
Yes.
you'll find all the measures that we've developed. So we have, for example, the 16-item maladaptive daydreaming scale has been now translated into some 35 languages and validated with excellent results in at least 5 or 6 different cultures and languages. So
Fantastic.
we also have the structured clinical interview for maladaptive daydreaming because we have suggested diagnostic criteria,
Yeah.
but of course, a self-report scale is not a diagnostic instrument.
Right.
So we have certain cutoff scores that people who score above it are suspected as being
Right.
probable maladaptive daydreamers. And then we do a structured clinical interview
Mm-hmm.
to nail down the diagnosis. And
Mm-hmm.
we're now developing child measures
Mm-hmm.
and brief forms of the scale. Research in this field is starting to blossom, and this is a construct that was coined only in 2002,
Mm-hmm.
with zero mentioning, of course, on the internet and zero publications on it. And currently, we have something like 70 research publications
Fantastic.
on the it's
That's
growing.
fantastic. So I'm going to make an appeal, scholar to scholar, to maybe add a research question or a link to another research question about if someone was raised in an authoritarian cult
Mm-hmm.
um, and gotten out but have never gotten therapy about that, and whether or not there may be some link, whether causative or correlational link.
Well, we know that there is a higher prevalence of trauma survivors among people diagnosed with maladaptive daydreaming. But it's not a condition, because people can be born with this trait and
Mm-hmm.
discover it and get addicted to it even without trauma. But of course, if people have emotional pain, it is so rewarding to be able to distract from this pain and go into a different world inside.
Right. So I can't help but ask you, since we live in 2024, as we're doing this interview, the internet is creating an alternate fantasy reality, and especially with the immersive units that are being developed based on collected data on our preferences and styles and AI, that we're facing an ethical potential, big plus or big minus with these immersive technologies. Have you started looking at all in the interface with technology in
No,
this?
I think it's a fascinating idea to explore further. But I'd like to draw your attention to the fact that we are talking about similar but very distinct experiences. In one, a person is watching or immersing themselves in a reality that is generated externally. And in the phenomena that I'm studying, people are generating their own scenarios
Internal. Yeah, that's a
internally.
very big distinction for
Yeah.
sure.
Hmm.
Yeah, absolutely. Locus of control is how I
Right.
think about it, is they're external
Right.
or
And tying into an issue that you're interested in, if the fantasized reality is indeed so real that people get a sense of presence, the question that you might be interested in are people encountering difficulties differentiating between memories of events that happened in real life and memories of events that they have fantasized.
right,
And we're looking into this question. And, for me, as coming from the trauma and dissociation field, is almost like feeling that I might be betraying my colleagues, going into the false memory camp. But I'm a scientist, and I'm interested in facts. And what we found is that people with maladaptive daydreaming do report uh, about incidents of false memories, and they learn that they're false because they have been refuted by other
mm,
people who were present. Uh, this is the biggest evidence of a false memory. But
right,
what are these false memories about? Well, what we learn is that people, particularly survivors of trauma, are absolutely disinclined to fantasize about trauma.
right,
So they don't fantasize false memories about being raped or abused.
right,
Why would they do it? I mean, they are phobic of these fantasies. So they tend to develop alternate realities, alternate scenarios. They sometimes are not sure if they happened or not. So this is a one class of, but most people can differentiate between reality and fantasy. But again, the motivation of people who are survivors is to develop alternative worlds in which that are much less threatening to them.
right,
Where false memories can occur is when they fantasize about immediate interpersonal relationship and they have conversations in their mind with friends and so on.
right,
So that sometimes they can act upon conversations that they have imagined and approach people, sort of continuing this thread and and,
right,
and and just only to much to their embarrassment to realize that such a conversation never happened. It happened in their mind.
right,
Um,
right.
so,
What I
so
Yeah,
go
please
ahead.
continue.
No, go ahead.
No, I was just going to say, in my practice, I will often ask people when they say, I now remember that was sexually assaulted by my relative in a childhood. I often ask, um, what happened just before you had that memory? And when I ask, they will often say, well, I was on YouTube watching a video of someone talking about this, or I saw Oprah Winfrey show on sexual abuse of children. And I saw, and so what I'm trying to bring up is a contagion effect, I think, or some type of external suggestion where the over empathizing with a victim of trauma happens.
Mhm.
And
But Steve, how likely are you to have a memory of childhood sexual abuse, provided you haven't had any, by watching such a talk show?
zero for me.
Yeah, because possibly because you had no childhood trauma of that kind.
Right.
So it is possible that external triggers and reminders will activate memories.
Right.
That's possible.
Yeah. No, I certainly get that. And I will add that a lot of my population were in mind control cults. So
Mm-hmm.
and they were often made to believe their childhood was much worse than it actually was. I certainly had that experience where I thought I had a terrible childhood and that my father was abusive. And after my deprogramming, I said that to my sister, that dad was abusive, and she was shocked. She was like, "What are you talking about, Dad?" And, he was abused as a kid. He never touched us. And I'm like, oh,
Mm-hmm.
yes, he did. And she's like, give me an example. And I had to stop and think. And I thought and I thought. And I remembered one incident when I was like 13 when he asked me for the change from lunch money and I lied to him. And he went like that on my cheek, like that hard.
Mm-hmm.
But that became conflated in my moony mind
Mm-hmm.
to, this,
Interesting.
to being abused physically.
Mm.
But
Yeah.
my sisters, my neighbors, all my
Mm.
relatives were like, you were a happy kid. Like, you know, if anything, dad didn't hug you
Mm.
and kiss you and say he loved you. If there was a problem that was more, he didn't have that loving as a child. He didn't do that
Right.
to his
Right.
son.
Right. So, in summary, I don't believe, and it seems like you don't either, that um, um, watching a talk show or even a movie and with explicit scenes would generate false memories.
Right. Now I'll add one more conflating issue, and that is psychedelics and sleep deprivation. Because
Hmm.
my experience is when people are tripping on psilocybin or mescaline or ayahuasca or whatever, they become incredibly vulnerable to suggestions
Hmm.
that and
Yeah.
so what are your thoughts
Well,
about?
that's outside my field of expertise, but you're probably referring to your area of specialty, and that possibly happens in environments where mind control is exercised. But let me tell you, I have an association to this that might be somehow related.
Mm-hmm.
Uh, there is evidence that survivors of the Nova Party in October 7th, in where
October 7th, the attack
the
by Hamas. Yeah.
yes, uh, some 1,400 youngsters were murdered there, but many survived, and they were high on several of those substances. And it turns out that those who were on substances seem to fare better.
Hmm.
Um, it somehow distanced them or changed their experience, either perceptually or in terms of how they regarded it or thought about it.
Mm-hmm.
So
Mm-hmm.
these are preliminary results that are released. I don't know if they were published yet,
Mm.
but it's intriguing. So that's
Yeah.
an opposite
Yeah, it's
outcome.
very intriguing. I mean, I'm fascinated by the human mind. I'm
Hmm.
fascinated by the mind body. I'm
Yeah.
fascinated with what we're learning about neuroscience
Hmm.
and obviously I'm committed to human rights and wanting to improve the human condition and wanting to help people who have been traumatized to get better and become functional. So,
Hmm.
can we circle back to your practice? So,
Yeah.
you described the cutting scores and some of the research for identifying maladaptive daydreaming and other dissociation. What is the treatment protocol? What helps people
Right.
to get
Right.
better?
Well, there are two components to maladaptive daydreaming. There is the addiction to this highly gratifying mental activity.
Yeah.
And if we think about this disorder in terms of an addiction, then it's a self-medication, isn't it? For
Mm,
what? I mean,
mm,
so that is an important underlying issue to uncover whether or not there are some underlying conditions and issues that the person is self-medicating with maladaptive daydreaming. So what this implies is that the treatment, we need to borrow some of the basic principles from addiction therapy.
mm,
So on the one hand, we need to provide individuals with means to better regulate and control this addictive behavior. But on the other hand, we must identify, and treat the underlying issue they are
mm,
self-medicating for. And these are different kinds of therapy. One
mhm,
is more cognitive behavioral, and the other could be more interpersonal psychodynamic. So, in
mhm.
terms of regulating this dysfunctional mental activity, the idea is not to stop completely, like you would perhaps expect a person abusing chemical substances. Uh, but I would compare it perhaps to an eating disorder. You can ask a person to stop eating, so you need to regulate it.
Good
So
point.
daydreaming is normal, and we're talking about something that in moderation can be highly creative mental activity that we call immersive daydreaming.
Right.
So the point is to help people, first of all, generate some self statements that would enhance their motivation
Mm,
to combat this highly gratifying mental activity. So
right.
they need to elucidate and um, and define for themselves what do they stand to gain if they control it better, and
Right.
what are they going to lose if they don't,
Right.
just to bolster their motivation. Then self-monitoring is important because people tend to underestimate how much time they spend doing it,
Right.
and that in itself is an intervention already, when
Right.
people need to become accountable
Right.
for what they're doing. And then what we learned is that mindfulness training is highly relevant and helpful when people, it is about helping training the mind to be focused externally and mindful about all the stimuli that are associated with smell, with touch, with
Mm-hmm.
what's happening in the body, sound, sight,
Right.
because people forgot how to do it. They are focused internally. So we
Interesting.
so we teach them to be present,
Mm-hmm. Mm-hmm.
and that seems to be very helpful.
Mm-hmm.
So these are the basic principles for controlling the addiction. But that is not enough. If you can't take away their self-medication without offering something else.
That's the principle of good
Yeah,
therapy. you
yeah,
know, You try to
Exactly.
find something that's more, helpful, useful without the negatives. I'm curious if people would, beyond tracking when this happens, whether or not if they would be responsive to saying, I think you should limit it to 3 times a day for 10 minutes and put on the timer and
Yeah.
deliberately do it. And
Yeah, we've been using some of these techniques, for example, using smartwatches or smartphones to generate these self-motivating statements or reminding people periodically, several times a day, to do mindfulness. Uh, but for some people, what works is to allocate time in which they don't need to combat this, but they can enjoy it. For
right.
example, after they have accomplished all their obligations and fulfilled during the
That's
day. Yeah.
makes the most amount of sense to me. Is like you
Mm,
want to be in the world, be in your body, get things done, pay attention to the people that you value and need you, and give downtime for yourself
true.
to enjoy yourself. That seems very logical to me. Um, I have so many other questions I want to ask you, just, as a supervisor of psychology students, because it just seems like our brains are getting rewired by being on the internet so many hours a day. I did an interview with a social psychiatrist, Carl Marcy, who wrote a book called Rewired, protecting our brain in the digital age. And he was going through developmental psychology and just talking about critical things that need to happen, especially
Hmm.
early in childhood, they need, he believes and I believe, the children need human interaction
Right.
to absorb emotions, to read faces, to
Right.
have
Hmm.
smells and all of that good stuff.
Hmm.
And so many people are now, I see them, they're with their young children. The children are on iPads or on digital devices, and they're not interacting with their parents, and they're not
That's
interacting
true,
with their
and that what brings some parents contact me about their children. They see the children are lost in their inner world, and they are concerned that something is missing there in the quality of their interaction.
right.
Uh, so that's our next challenge, to be able to identify this early on, because if this is an innate trait,
Mm,
we already know that it first manifests itself in childhood.
right.
So it's important to identify this early, among other things, so the child can enjoy more family relations, provided they are helpful and that there's love and caring there.
Hmm.
But again, let us remind ourselves that sometimes families are not functioning as optimally as we would want, and some of the children growing up in these families must resort to other means of sustaining themselves.
Right. So, is there I'm going to just shift again back to your expertise in dissociation. Is there now a tried and true way to help the more extremely traumatized children in childhood, the DIDs, the dissociative identity disorder clients?
Yeah, I'm sighing because this is such hard work for both therapist and patient.
Right.
Um, Again, this kind of therapy ultimately requires the patient to give up on these very powerful defenses of, this never happened to me, it happened to her. And I
Right.
don't know what she's talking about because it never happened to me. I mean, this is a very powerful way of coping with the inescapable and the intolerable trauma. And we're
Right.
asking them to give them up and to own what she went through, the other
Right.
one.
Right.
This is big. This is big. So
Yeah.
we must give a lot of ourselves be there for them beyond the 50-minute session, and proceed with great caution, very slow. This is long-term therapy.
Right.
And of course, it puts us in disadvantage compared to the manualized 10-session therapies, the big cognitive behavioral therapies, that you can produce very quickly evidence of how it works by manualized protocols.
Right.
This is a different ballgame here.
Yep.
Mm-hmm.
Yeah,
And,
totally. And
yeah.
I've stopped doing DID cases. It was too draining and
It is
too
incredibly
time-consuming.
draining.
But
Yeah.
I can tell you where I'm at now at age 70, having been doing this work for nearly 50 years. I just say to my clients, look, it's your mind, it's your body. I want to empower you to have an internal locus of control.
Mm-hmm.
I don't want to be your mind. I want you to be your mind. I want you to know yourself. I want you to be in your body, in the here and now, with a positive future orientation to a future self that you designate, the kind of future you want to have, and not dwell in the past unless the past is keeping you from moving forward into the future. And a lot of times with that body-centered here and now plus future focus, there's less emphasis on doing the work in the past with the parts. And we can summon parts to help us with different skill sets, maybe to achieve things, because different parts do have different skill sets and such. But to have a single eye, and I like the metaphor that I was taught way back when I started getting training, like being the CEO, and you have all the parts around the big table, and you listen to all of them. Nobody feels like they're ignored, but you don't let them control the meetings. You're the CEO. You're in charge of the company. That kind of metaphor.
Sounds like you found a good way to help some of these clients.
Yeah.
Good.
So circling back to your decades of expertise and research. By the way, we're doing a blog based on this, and we can put links to significant research you've done and instruments and such. But any other words of wisdom for any listeners about the whole issue of trauma and dissociation and maladaptive daydreaming, please?
Well, years of experience and exposure to these clients have made me quite humble in terms of knowing what's good for them. I see so much suffering that sometimes I'm left aware of my limitations. So what I sometimes offer these patients is less a matter of technique, but just the empathy and the pain that I'm daring more now to share with my patients. I think the bottom line is that there is hope. We know from our experience and from the research that is accumulating that people with DAD can be helped, but it's we're dealing here with, as I called it, intolerable experiences, and sometimes, people come with expectations to uncover everything, and I discourage them from doing it.
Me too. You don't need to know everything, only if it impinges on your ability to live a good life now.
Yes,
that's what I tell my clients.
Exactly. And I think another lesson is that we need to be able to take care of ourselves, the therapists, because there is undoubtedly secondary traumatization.
Absolutely
engaging with family and friends and Enriching our lives with culture is so important.
And having joy and creativity, music. They're fun. We're learning about the neuroscience of music and how important it is.
Yeah, definitely.
For us to enjoy. And we can get entrained when we're listening to a concert or listening to a song or singing along.
Music is helping me a lot.
Yeah, it's so great. Eli Somer, PhD, Professor Emeritus of Psychology, former president of the International Society for the Study of Trauma and Dissociation, and now a senior researcher, founder of the International Consortium for Maladaptive Daydreaming Research. Thank you so much for being you and for sharing your expertise with us today.
My pleasure. My pleasure.
Thanks. Bye. Steve Hassan here. It's been decades since my family rescued me from the Moonies. I've been at this for over 47 years. The need has never been greater. If you're able, please consider hitting the super thanks button below, and it'll help us to do better. Every penny will help us toward our goal of educating the planet about undue influence. Remember, it's your mind. Only you should control it.